Océane Flavigny lived in Cambrai, France, and underwent 2 cosmetic surgeries. The first surgery did not go well, so she had it redone. When she consulted with the new surgeon, he informed her that the previous surgeon had also reduced her nasal turbinates. X-ray images revealed a large hole in the center of her left nasal turbinate. Additionally, a small perforation was visible between the left nostril and the left maxillary sinus. It is highly likely that her turbinate surgery was performed using a heat-based method such as radiofrequency or coblation. 2 years after her first surgery, Océane started to experience issues with the mucous membrane in her nose. It became dry. She wrote that her mucosa had degenerated, and she thought it might have started with a COVID infection. In some of her posts, she mentioned that she had secondary atrophic rhinitis and empty nose syndrome. She was a member of at least 2 Facebook groups for empty nose syndrome. She once tried to contact the Italian doctor Fabio Piazza, but he never replied. Fabio Piazza is a doctor who helps people with empty nose syndrome. During a conversation with a friend, she mentioned that she wanted to undergo another surgery. They discussed whether Christophe Gaillard in Paris could be a good option. Her friend then wrote, "Gaillard deletes bad Google reviews. The guy opened a new account to post something again. It is common practice. I would rather take it as a red flag." Eventually, Océane had a second surgery with the new surgeon. She chose Christophe Gaillard. She also wrote to her friend that the purpose of the surgery was to fix functional issues with her nose caused by the first surgeon, Marion Bouzebach. The second surgery was performed on April 24, 2023. Océane still had her turbinates remaining, but suffered from nasal pain, dryness, crusting, bad odors emanating from the nasal mucosa, discomfort while breathing, insomnia, and nasal congestion. We are not aware of all the problems related to her surgery. The first surgeon denied having performed a turbinate reduction, but the X-ray images clearly revealed this to be untrue. The information about Océane is quite limited. We know she sought help in several empty nose syndrome support groups and wanted to try stem cell injections in her nose but lacked the funds. She also tried to improve her condition by taking various vitamins. 3 to 4 weeks before her death, Océane posted a picture on her Facebook profile with the following text. "For my funeral, I authorize someone to take a wreath of flowers and throw it backwards to see who will be next." She likely knew at that point that she was going to die. After speaking with a friend of Océane, it seems clear that her death was another suicide caused by nasal surgery and turbinate reduction. The name of the first surgeon is Marion Bouzebach. She is active in Rennes, France. This is the surgeon who claimed she didn't touch the turbinate, but according to X-ray images, she did. 12 months and 26 days after Océane's second surgery, she passed away. Everything we found indicates it was another suicide due to complications and suffering after rhinoplasty and turbinate reduction. Océane Flavigny left this world far too early at the age of 30. She passed away on May 20th, 2024. Her Facebook name was Océane Fly. Océane's second surgeon is named Christophe Gaillard and is active in Paris. A link to his clinic can be found under the video description. We know Océane's first surgeon, Marion Bouzebach, is still active today. She received no penalty or warning after the poorly performed surgery, and she has at least injured one more patient. I have spoken to this individual, a friend of Océane's, and she is experiencing very similar complications and problems after surgery as Océane did.
Et dans la fureur